All right, so maybe we'll get started with introductions, and then people will be able to get back. And maybe actually, I don't know if somebody can go out there and alert wherever the coffee is to get the community members back in. Thank you everybody for coming today, and thank you in particular to our esteemed panel. So I guess the way that this day is running, at the beginning of the day we heard a little bit about the importance of having a framework for evaluation of pain medications like opioids, and then a little bit in the last session we heard about the legal and regulatory authorities under which this framework can be designed. And I think the point of this next panel of experts is to talk a little bit about the considerations for the framework itself, and what might go into a framework, and what sorts of considerations are useful in this circumstance to take into account, and what are not useful, and how do we do that. And I think that we have a fantastic group of people today in from all over the country to try to inform the committee's deliberations and discussions on this topic. So first we're going to start with Dr. Bruce Sadie, who's a professor of medicine, epidemiology, and health services, and co-director of the Cardiovascular Health Research Group at the University of Washington. His research interests include drug safety, pharmacoepidemiology, and pharmacogenetics. He serves as chair of the U.S. Food and Drug Administration Science Board, and is a member of the National Heart, Lung, and Blood Institute Advisory Council. Then we'll have Wendy Parmet, who is the Matthews Distinguished University Professor of Law, Director of the Center for Health Policy and Law, and Associate Dean for Interdisciplinary Education and Research, Professor of Public Policy and Urban Affairs at Northeastern University School of Public Policy and Northeastern University School of Law, and is a leading expert on health, disability, and public health law. She's published articles on public health, bioethics, discrimination, health law, and AIDS law. And next we'll have Caleb Alexander, who's an associate professor of epidemiology and medicine at the Johns Hopkins Bloomberg School of Public Health, where he serves as the founding co-director of the Center for Drug Safety and Effectiveness, and is a principal investigator of the Johns Hopkins Center for Excellence in Regulatory Science and Innovation. He's a practicing primary care physician and internationally renowned pharmacoepidemiologist, and the author of over 200 scientific articles examining prescription drug utilization, safety, and effectiveness. And then finally, we'll have Diana Zuckerman, who's the president of the National Center for Health Research, a nonprofit research and education organization that conducts and analyzes research and uses the results to improve policy and programs affecting the health of adults and children. She has testified about the safety and efficacy of medical and consumer products before Congress, federal agencies, state legislative committees, and the Canadian Parliament. Trained in epidemiology and public health in Yale Medical School. She worked as a congressional staffer and a senior policy advisor to First Lady Hillary Clinton, and she currently serves on the board of directors for the Alliance for a Stronger FDA. So I think what we'll have is we'll have each of the discussants for 15 minutes to present their thoughts, and then at the end we'll have 15 or 20 minutes for group conversation. Thank you very much, and Dr. Sadie.